He's on his shoulder. What I'd like to do next is have the downside leg back a little bit, because this, the weight of the thigh and leg here, helps hold the patient kind of rooted on the table. As I pronate him, he's not going to tend to continue forward. He's going to be kind of balanced there as I roll him forward. Okay? He's going to have some weight behind him as well. All right? So I flex the knee. Some people like to rest the foot dorsum in the popliteal space. I usually just let it rest over it. Okay? So you flex the knee, and then you flex the hip to 90 degrees or just shy of 90 degrees. You're not maximally flexing the hip here, because if you maximally flex the hip, what motion are you going to tend to induce?
Extension.
Right, you're going to tend to want to kind of load into posterior non-rotation, and that's not our goal. Our goal is to thrust into anterior non-rotation. So we're just using this so we can get over the patient, so we can get contact. So we want to, if you will, as I flex the hip, I feel where it sort of stops naturally, easily, as opposed to winding it out all the way. See the difference? As I'm flexing him, kind of right about there is where it stops. I'm putting a little pressure with my thigh against his knee into his pelvis. See? Feel where it stops there. Okay? Now, I've got the PSIS in my so-called indifferent hand. Move the soft tissue out of the way. I'm just going to do this over the pant for now. But you're going to do it skin to skin or over the underwear or right over the shorts you have on. Okay? So, thumb, tissue pull, get a little hypothenar in there. Relax your fingers. Okay? My front leg now goes up against the bench. I make my contact, and I take my patient and I, like a rotisserie, kind of bring his whole body towards me. See what I've done? Right against my thighs. I've got control. And he knows nothing's going to happen if I drop my hands. I've got him. Now watch my back leg. This is what's crucial. This pocket here is going to wind up way up here. I'm going to come way up. Watch how far up I have to come. On the ball of my foot, I'm going to raise this foot way up. Turn my pelvis in after I'm up, and then I'm going to drag back down along the side. Okay? So let's do that one more time. Let's drop this table a nudge. You okay? You balance there? Here, the height of the table is crucial for you doctors. Okay? There are some nice low tables. There are also some of those platforms. So between the two of those, you should be able to adapt yourself the way you need to. Okay? Okay, so who thinks I'm going to trip by a quarter after? 20 after. Back leg, back, downside leg back a bit, okay? See what I've done here? Get my contact, pull, get in, contact, contact. My front leg's against the bench, pronate the patient slightly, against me. Watch my back leg now, way up, and then I turn in. See how I rotate my whole body inward? And then I drag my pelvis back down along his thigh. Okay? Now notice I'm nowhere now near the back of his gluteal region. I want to be on the side of his thigh with my thigh. So my pocket is very close to his pocket, isn't it? I'm not back here. All right? Rewind. Here, here. Pronate. Way up, more than you think. Way in, more than you think. Roll down. Then once you're here, you want to then just drop your body back. See what I'm doing now? Load into anterior non-rotation, drop and push. I'm trying to have a table that slides out. See,
You go back on
basically.